Okay, hello. Just checking everyone can hear me. Yeah, great. All right. Well, look, thanks everyone so much for joining us. Actually, I'll just let everyone in. There we go. You're all good, Beck. I'll do these slides. Yeah. All right. Well, welcome everybody to information session on the University of Queensland Graduate Certificate in Digital Health and Clinical Informatics. For those of you who don't know me, Claire Sullivan's my name. I'm an endocrinologist at Metro North, but most of my time is spent as the director of the new Digital Health Centre at University of Queensland. We're really excited about this graduate certificate because I think we can do all the things we like at the university or in the hospitals, but unless we have a really good understanding of what digital health is and how our workforce needs to change, we're kind of wasting our time a little bit. So the idea of this graduate certificate is in some ways all the things I wish someone had taught me when I started my career. I'm going to introduce you to somebody who's helping me today, Dr. Rebecca Eden. Beck, would you like to say hello and introduce yourself?
Thanks, Claire. Hi, everyone. I'm Rebecca Eden. I'm a senior researcher within QDEC and also the Business Information Systems School.
Yep, thanks, Beck. All right, we might get started. Is everyone seeing those slides? They're working? Yep. Okay. Before we start, I would like to acknowledge the traditional owners of the lands upon which we're meeting today. We acknowledge the traditional owners of the lands you're joining in this session and pay our respects to ancestors and their descendants who continue cultural and spiritual connections to country. And we recognise their valuable contributions to Australian and global society. Okay. I don't think I actually will show that video today. I think I'll just go straight into why did we do this graduate certificate. So any of you who work in health know that healthcare is no longer sustainable. We have queues out the back of the Royal Brisbane. We have lots of expanded waiting times for surgery. And that's because a lot of the ways we deliver healthcare is actually designed in the 1950s. We've changed many things since then, but unfortunately not the way we've structured outpatients and emergency departments. The advent of digital information, though, gives us the opportunity to really understand what those healthcare journeys are doing, to monitor them and hopefully improve those systems. So the graduate certificate is really a certificate that we hope would equip you with the right skills to lead digital transformation in healthcare. That's really it in a nutshell. We've been a bit more specific here around developing digital health and clinical informatics skills, supporting the development of clinical informaticians, helping you reach AIDH competency requirements, which are currently under development, and creating a flexible curriculum. And we have assumed that if you are doing this graduate certificate, that you have a full-time job. So I'll just be open about that. We've designed it assuming that you do have a full-time job. So it's really designed around full-time workers, the workload's not too onerous, and obviously the contact hours are kept to a minimum and are at a time that people with a job and a family could actually achieve. Okay, so there's three main groups that we think would benefit from the grad cert. The first is clinicians, and most clinicians these days have to touch digital technology. And if all you want to do is touch it, that's totally fine. But if you're the type of clinician who wants to understand digital health, who wants to understand AI, who potentially wants to lead in this space, or potentially wants to be a CCIO or a CMIO or a CNIO or a Chief Allied Health Information Officer, then taking the graduate certificate is going to be really helpful. Many people in those roles today are self-taught or have learned on the job, myself included, and really that's not ideal. So this curriculum is designed, I guess, to really give those CCIOs of the future the right skills. The second cohort is IT staff who want to understand digital healthcare. And health is one of the largest employers of IT staff, as I'm sure many of you know. Some of those IT staff come to us from banking, finance, mining, and health is very different. So this graduate certificate is also helpful for those technical staff who might want to become a CIO in healthcare. It's very difficult to become a CIO in healthcare industry without understanding the basics of the health industry, how it works, terminology, for example. So that's the second cohort. And then the last cohort is, I guess, non-clinical. And that is executives and health leaders who understand that digital health is the greatest single quality improvement and system improvement tool that we have. So we can do all the behaviour modification that we like, really, process mining and all the rest of it. But when I look at the reduction in medication errors that happens overnight with the implementation of an electronic prescribing system, it's unparalleled. So if you're interested in ever running a healthcare system, you really need to understand digital technology. You need to understand AI, and this course will give you the basics for that. Just to give you a sense of the scale, and we have been oversubscribed in this course, as many of you probably know, and that's, I think, because of what's going to happen over the next 5 years. So there's recommendations out in the Topol report that 10% of all healthcare workers have a qualification in digital health. For our technology friends, the US dollars 500 billion is about going to be the market value of IT in healthcare by 2025. And our leaders, our future leaders, need to know how to manage the rapid change that's going to be brought about by technologies such as AI coming into the healthcare sphere. So a lot of very large reasons why those three groups would be interested. Okay, how do we structure the program? So there's 4 modules over 2 years. We have essentially structured it along the 3 horizons that many of you know around digital transformation. So the first horizon is digital workflows. The second horizon is data and analytics, and the third horizon is reimagining healthcare and new models of care. Horizon 1 is split over 2 modules, and that's got the basics, I guess, of digital health. So how to roll out an EMR, what is clinical decision support, terminology, how do people adopt new systems or why don't they, budgeting, putting together a business plan, you know, the basics that you would need if you were going to run a healthcare system, particularly digital health. The third module is probably the most popular one, which kind of annoys me because I like the basic stuff, but module 3 is all around AI and precision medicine, and this is run by some very, very clever mathematicians and epidemiologists. And this really takes... Hey, T, I think you might need to mute yourself there. Yeah, cheers. Module 3 is really around how are AI models constructed, how should we govern AI models, and how should we implement them in healthcare. The last module is one I actually teach with Andrew Burton-Jones, and it's my favourite. It's about, okay, you've got your digital workflows, you understand AI, how do you bring it all together now and actually change the way healthcare is delivered? And that module has what we call capstone projects, where we actually will link you up with a healthcare provider. For example, this year, Andrew and I arranged for our students to do digital health strategies with Indigenous healthcare providers, to actually put into practice what you've learned over the course. And they delivered the most wonderful digital health strategies for these healthcare providers, and it was a lot of fun. So that's the structure of the course. The applications close in January, about 7 hours a week, but lots of clinicians are really quite fast and may actually do less than that, but I'll leave it at that. We've been very fortunate in receiving Commonwealth supported scholarships for this course, which I'm really proud of. So that means that the federal government thinks this course is worth funding, which reduces the fees significantly. Prereqs, so you do need to have a bachelor's degree. If you don't have a bachelor's degree, we have had a few people who have had significant workplace experience, which we considered equivalent to a bachelor's degree. So don't despair if you don't have a degree, contact us. And if there's enough on-the-job experience, you'll still meet the entry criteria. Yeah, that's a bit more about the Commonwealth supported places, but yes, does result in quite a large saving. Here's one of our students, Simon, who's just been terrific. He's just about to finish, and a lovely little testimonial from him. And he's a lead consultant in digital health at Metro South. He's been fabulous. Okay, I might stop there. We might have just a few questions if that's all right, Beck. We'll also have some questions at the end, but is there any immediate questions?
Hi, yes, I did have a question.
Hi, Chelsea.
Hi, so I was wondering how the course is set over 2 years part-time. Is it an option, for example, if we did finish the content earlier, to finish it within a year or however long that might be?
Yeah, you could theoretically do 2 years at once, Chelsea, if you really wanted to. So it's not self-paced. We actually do have content. We actually have face-to-face meetings. I didn't want this just to be an online course, you know, because you can do an online course anywhere. It's the face-to-face discussions and meeting your team, you know, that sort of make it worthwhile and really create that cohort and network.
Sure.
Yeah, so you could, I guess, we have, I think, had somebody do the 2 years at the same time. So they did year 1 and year 2 at the same time to do the whole thing in a year. I think that would be very hard to do in terms if you had a family and a full-time job, but people have done it. Yeah.
Okay, sure. And then I did just have another question about the fees. So what is the total fee for the course and what is the fee with the CSP in place? Would you know that?
Tim, can you just explain to us the total cost?
Yeah, Claire, if you go back a couple of slides, I should have all that information there just for everyone.
Is that the one, Tim?
Back one, I believe. Or maybe one more, sorry. Yeah. So the indicative annual fee there.
So it's $44.75 per year times 2? Okay, sure. And
correct,
is the CSP, is that with the CSP?
That's with the CSP applied, yep.
Okay, perfect. All right, thank you.
Okay, I'm just conscious of time, so Beck, we might let you, Chelsea, they were great questions and I'm sure they were on everyone's mind, so thank you for asking them. We'll hand over to Beck. Beck is a real digital health genius, and so I wanted you to hear a little bit from her and about what she's doing with her digital health education, and then we'll stop at the end for some more questions. Go, Beck.
Perfect, thanks, Claire. So hi, everyone. That was really lovely words of Claire. I'm Rebecca Eden. I have been researching digital health since about 2017, so for the past 6 years. And like many of you, I really believe that digital health is the key to creating a sustainable health ecosystem. However, in order to achieve that transformation, we effectively need ongoing work and activities to really build up the digital capabilities of the healthcare workforce. So for the past 6 years, I've been really drawing upon my business information systems expertise. So I'm not a clinician by trade. I am a business information systems expert, and I collaborate strongly with clinicians like Claire and others to really ensure that the findings that we're generating are truly impactful to practice. So the digital transformations that I've been investigating have been about sort of implementing an integrated electronic medical record system, using that system and the data contained within to actually transform into a sustainable learning health system that fulfills the quadruple aims of healthcare. So that's all about improving the care team's well-being, improving the patient experience, reducing healthcare costs, and improving the health of the population. So what do we mean by learning health systems? So learning health systems really seek to improve the value of healthcare. Sorry, Claire, can you go back one slide? Yeah, the value of healthcare via rapid learning from data and immediate translation to practice and policy. So effectively, it's about using the data contained within digital health systems, leveraging that data at scale across multiple levels of healthcare stakeholders to transform how we deliver care. Next slide, please, Claire. So initial steps have been made. Yeah, so previous one.
Sorry, I'm not very good at the slide thing, am I? I mean, goodness me, you shouldn't let me near the computer, but anyway.
Yeah. So Queensland has made initial steps to this. We've got 14 digital hospitals in the state that have an integrated electronic medical record system, and other 14 digital hospitals are actually planned for go live. We have seen initial improvements in healthcare outcomes with an increase in inpatient activity, decrease in infections, and a decrease in medication complications. And similar efforts are underway across multiple states within Australia. Next slide, Claire.
Sorry.
That's all right.
There we go. Is that?
Yep. So one more. So it should be the workforce. Yes, this one. Yeah. So the key to this actual digital transformation that's been ongoing throughout the state and throughout Australia has really been all about transforming the workforce. So you can't just do digital transformation and change everything to electronic and then think that it's all going to be new and wonderful. You need to accompany it with workforce transformation. And we saw that workforce transformation involved individuals and healthcare organizations flexing their capacity to meet the external forces. It involved complete revitalization. So thinking about new roles, new processes, new procedures, and also deepening that healthcare workforce by actually reflecting on what is the organization's culture and how can we reimagine a more ideal version of ourselves and actually act towards accomplishing it. To achieve those three activities, healthcare organizations need to establish a culture for successful workforce transformation. This includes organizations valuing things like innovation, collegiality, and evidence-based practice. Healthcare organizations also need to build an ongoing digital workforce transformation competence. So effectively, what this means is allowing staff members within your organization to engage in things like collaborative visioning or evidence-based improvisation to really transform care. And healthcare executives need to manage the tensions across all these levels of transformation to enable quick wins happening at the local grassroots levels all the way up to really sustainable level changes. Next slide, please, Claire. So to facilitate this transformation, interdisciplinary collaboration is critical. It's super important that we break down the silos that exist between clinicians, management, technology, and data experts so that we're all speaking the same language. So we have a shared common understanding, because only with that common understanding can we facilitate ongoing optimization efforts to transform the healthcare industry into that learning health system and to attain those quadruple aims of healthcare. Thanks, Claire.
Great, thanks, Beck. So look, Beck, I think you've convinced me around the workforce, and I think we're seeing that disruptions in so many different places across the healthcare system. Okay, any questions? No comments, questions, just raise your hand or please feel free to put it in the chat. I might just ask Beck. Beck, what do you think is one of the biggest problems facing the healthcare system at the moment from your perspective? And I mean, you're pretty deeply embedded in it. So, you know, if you were to do a grad cert, what sort of problems do you think that you could be equipped to handle?
Yeah, so I think there's two things. I think the grad cert really sets everyone up to actually engage in that interdisciplinary collaboration, which is super critical. And I think the other thing is just really a recognition that it is this really resource constrained environment. So we have the technology there, it's implemented, but how can we really use that technology and act on that technology in more intelligent ways to actually have really core outcomes being derived?
Yeah. And I think shifting it from an entrepreneurial activity, don't you think digital health's been a bit of an entrepreneurial activity, you know, hackathons and all the rest of it. But now we actually need to kind of embed that just in the healthcare system. And I think programs such as the grad cert, I hope, are equipping people with confidence to make it just part of their daily work, not sort of a hackathon activity or something weird from the outside.
Exactly. It's almost like it's a continuous improvement sort of initiative as opposed to things that happen sort of on a once off and then we forget about it and then another once off. It's about really embedding that into practice, 100%.
Yep. Alan.
Hey, Claire, how are you? And then from QU2. It's been a long
I
time.
thought it might be you. Oh my God. Just so everyone knows, Alan and I used to work together and he's an absolute champion. Alan, I can't imagine you need to do a graduate certificate. You would know it all already.
Health or AI. My question is, now that we know that the current healthcare system is not sustainable and you need to bring in new ideas, but then on the other hand, we realize that AI in general is a threat to workforce in terms of like losing jobs. How can we overcome that fear when we dive into this AI, try to facilitate healthcare? People could be fearful of its utilization or application to our work.
That's such a great question. So just so everyone knows, Alan Lamb is a general physician and the director of internal medicine at QE2 Hospital. So Alan, I guess you really are seeing the pointy end of this. You're right. So AI will change the way that we work, and I think we're seeing that already. So we have doctors using generative AI to help them write patient information sheets, for example. But I don't think AI in our lifetime is going to replace doctors. So I think it will help doctors, but I don't think it's going to replace them. And when I say doctors, and that was your question, I guess I'm also thinking about allied health, nursing, and everyone else in the team. There's a great saying one of my colleagues from San Francisco says AI won't replace health practitioners, but health practitioners who use AI will replace those that don't. So I think that if you are a clinician, you do need to understand how to use AI safely. You do need to be able to critically appraise it, to understand if what the tech, salesperson telling you is correct or not. And if you're a clinician, you also need to know how to govern it. So if there's an AI algorithm running in your department or running on your radiology software, who's monitoring those outcomes? Is it safe? What happens if the environment changes? Are you revalidating the AI algorithm? And those questions are addressed in the grad cert. We think it's really important that people understand that these are very real questions and ones that need to be addressed in an academic sense and not in a sales sense, Alan. So I think we're sort of seeing that, like the drug industry was, 20 years ago, lots of sales and hype. And I think, like we did with the drug industry, it'll be regulated. The people like you that understand it will start to ask questions and regulate it. But I don't also want to hold it back. I think AI has the potential to really streamline many laborious, boring processes that clinicians have to do. So we absolutely need to embrace AI. But what we're hoping to teach you all is to do that in a way that is thoughtful and safe, but maintains that therapeutic relationship between the consumer and the clinician. So we just see it as another tool in the toolkit. And we spend quite a lot of time, almost a whole module around that. Any other questions or comments? No.
There's some questions in the chat, Claire.
Oh, is
I
there?
think you might have to unshare your screen, yeah.
Yeah, okay. In your opinion, is there much overlap between CHIA? Oh, okay. Bonnie, great question. So CHIA is a certification. It's not an education. So CHIA is about certifying knowledge that you have. The CHIA is run by volunteers, as you know, at the Institute, and I've done my CHIA as well. Please don't take this as a criticism at all of the CHIA, but it's not really an educational program. So it is a certification of knowledge that you've gained. I think CHIA is great to give you some language, help you understand what is PRODA, what is My Health Record, for example. But the graduate certificate actually educates you. So it's around understanding and critically appraising things like analytics or AI or how to write a digital health strategy. We have face-to-face sessions with experts and we actually do projects as part of the grad cert. So I think CHIA is a great introduction. And if that's all you need, then I'd stop there. But if you genuinely want to take an educational pathway in digital health, then I think grad cert's the right thing. Clem, how is this certificate going to help my patients? I don't think it will help your patients, Clem. I feel a bit embarrassed to say that. I don't think the certificate will help your patients, but hopefully the knowledge that you gain through the certificate will allow you to think about the care you deliver in different ways. So might empower you with the statistical expertise to be able to analyse your outcomes, for example. When an AI algorithm comes and promises to help you in your practice, in your GP practice, is that real? Perhaps you're the sort of GP who'd like to write an AI algorithm. So yeah, I don't think the certificate itself will help you, but I'm hoping that the knowledge that you're learning through the grad cert will help. Clem, I hope that answers your question all right.
Are you able to give any information how this would apply to us in the pharmacy space?
Yeah. Pharmacists, really important, Chelsea. So I think pharmacy has been overlooked in a lot of the digital health work because pharmacists are actually pioneers of lots of clinical information systems, as you know, right? Just in Queensland alone, Charm and Elms, all driven by pharmacists. Personally, I'd like to see chief pharmacy information officers at every hospital and large centre. I think that pharmacists are the stewards of medication safety, and pharmacists really need to understand digital health. The applications for artificial intelligence and precision medicine in pharmacy are unparalleled. So an example that we talk about, for example, is understanding if we know someone's genotype, we actually can prescribe different drugs, or we can, using AI, predict how they're going to react to a drug. So I think pharmacists absolutely need to be leading the charge in digital health. Juliana's asked about scholarship opportunities. We probably don't have time to talk to that in length, but Tim, could we email that link out, the scholarships page, to everyone?
No problems.
Are you able to also share a copy of the slides?
Yeah, sure. No worries, Chelsea. We'll send that around. The capstone project. So, Ellen, it's essentially around writing digital health strategies for healthcare providers. We understand everyone works full time. Mari, just to your point as well, we've designed the course assuming everyone works full time. So the contact hours, I actually teach in the evening, so you all can attend. So yes, we do assume everyone has a full-time job. And yeah, I know my family's not so sure about that, Mari, but no, it's fine. Yeah. And I also wanted to make sure we were inclusive, so people who are regional, remote can also join. AFRA, community services, please. Community services really needs digital health. Again, it's been neglected. We've put IMRs in all our acute hospitals. Oh my goodness, if we could link up with community services, how much smoother would our consumers transitions, please? So yes, please do come. I would love to see digital transformation of community services. Emma, yes, primary care is the backbone of Australian healthcare. I think part of our issue around primary care is that it's been very stuck in that first horizon. So primary care actually adopted EMRs way before hospitals, but the use of the data contained within those systems for quality improvement and artificial intelligence has actually not been fast. So yes, we do need to look at primary care. How can we start to unlock the compute power of the data in those EMRs? General practice is the perfect place for artificial intelligence, if you ask me. Let's do some predictions about your lifetime risk of things when you come to see me for your pap smear, for example. So yes, very, very keen to have primary practice. And in fact, the capstone projects that I did this year were all with primary healthcare providers. Adrian, yes, hello, Adrian from Jakarta. Oh my God, you just have to say hello. So Adrian came to visit us. He's here from Jakarta. I think we are taking international students now. Is that right, Tim?
Not yet, Claire. We haven't quite hit that milestone just yet, unfortunately.
Sorry, Adrian.
But soon, and we do have Adrian's details as well to reach out as soon as we can.
Yeah, Adrian, we might be able to do something special separately or something for Indonesia. I don't know, but for those of you who don't know, Indonesia is the most incredible country when it comes to digital health. Have a wildly ambitious program, and we're really, really excited to be working with our Indonesian colleagues on that. I think I'm hopelessly out of time. I am going to have to go. If people want to contact me personally, please do email me. I have some more questions in my mind. Same to Clem. Laura, yes, you're a registered nurse. Absolutely. You'd be a suitable candidate for the course, and I need more nurses. Nurses are the largest component of our workforce. They need to be digital health leaders. Okay, I'm getting the wind up here, so I better go. I could talk about this all afternoon. One thing I will say is that we've made the course fun. And we have a great group of lecturers and lovely, lovely students. And please contact me if you have any questions. We'll send around the slides and the scholarship opportunities. And Beck and I hope to see some of you later on. Thanks, everyone.